Bismillahirrahmanirrahim. Now we are starting our part, starting from question number 41. When he attempted to lift one side of his new electric automobile from the ground to demonstrate his strength, the 51-year-old man felt a sharp pain at his back and quickly dropped the vehicle. Upon examination, it is observed that the patient had deficits in sensation on the dorsum and sole of his foot and marked weakness in abduction and lateral rotation of the lower limb. What was the nature of his injury? Piriformis syndrome with entrapment of the sciatic nerve, disc lesion at L3, L4, disc lesion at L4, L5, disc lesion at L5 to S1. The answer is C, disc lesion at L4 to L5. The scenario, sudden back pain while lifting is a classic for an intervertebral disc herniation. A lesion L4, L5 commonly compresses the L5 nerve, producing sensory disturbance of the dorsum of the foot and weakness of the muscle that receive L5. Notably, gluteus medius minimus, hip abduction by the superior gluteal contribution, L5 dominant, and muscles that contribute to the lateral rotation, foot control. Although sole sensation is usually by S1, and a large L4 L5 herniation can improve adjustment roots or produce mixed findings. Overall, the presentation mechanism plus dorsum involvement plus marked abduction weakness fits an L4 to L5 disc lesion better than piriformis syndrome or a hip dislocation. Question number 42 is 3-year-old. For 3 year following a 62-year-old hip replacement, the man CT scan identified that two of these large hip muscles had been replaced by adipose tissue. The opinion is offered that his superior gluteal nerve could have been injured during the replacement procedure and the muscles supplied by that nerve had atrophied and had been replaced by fat. Which of the following muscle receive its innervation from the superior gluteal nerve? Tensor fasciae lata, rectus femoris, gluteus maximus, piriformis, and quadratus femoris. The answer is A, that is tensor fasciae lata. The superior gluteal nerve supplies gluteus medius minimus and tensor fasciae lata. Gluteus medius maximus is supplied by the inferior gluteal nerve, rectus femoris by femoral nerve piriformis, and quadratus femoris by the respective small nerves. Question number 43 is a 49-year-old male worker fell from a ladder with his weight impacting on the heels of his feet. A radiologic examination reveals committed calcaneal fractures. After the injury, the contraction which of the following muscles could most likely increase the pain in the injured foot? The options are flexor digitorum profundus, gastrocnemius tibialis posterior, tibialis anterior, peroneus longus. The answer is B. Gastrocnemius with soleus attaches to the calcaneus by the Achilles tendon, which we have already discussed in the previous Bcqs. Contraction pulls on the calcaneum and would worsen pain after the commuted calcaneal fractures. Other muscles listed do not insert on the calcaneum. This is how you can eliminate the other options. Now comes to the question number 44. A 24-year-old woman received a small caliber bullet wound to the popliteal fossa from a drive-by assailant. The patient was admitted to the emergency department, whereas the surgeon recognized that the bullet had severed the tibial nerve. Such an injury would likely result in which of the following? You better know this thing. The options are inability to extend the leg at the knee, foot drop, dorsiflex and everted foot, a plantar flex and inverted foot, total inability to flex the left foot. The answer is dorsiflex and everted foot. Severing the tibial nerve, remove plantar flexion and inverters, gastrocnemius soleus and tibialis posterior. With those lost, the unopposed muscles, that is the deep common peroneal nerve and superficial fibular nerve, produces dorsiflexion and eversion of the foot. Foot drop is equal to loss of dorsiflexion, that is common fibular lesion, not a tibial lesion. Question number 5 is a football player has instability of the knee joint due to the forward the slapping of the tibia on the femur during flexion. Which ligament is torn? Anterior cruciate, lateral collateral ligament, medial collateral, oblique popliteal posterior cruciate ligament. The answer is anterior cruciate ligament prevents the anterior displacement of the tibia on the femur. Now comes to the question number 46. A child with polymyelitis is unable to tilt his pelvis while walking. Which muscle is weak? Options are gluteus medius, obturator internus, piriformis, quadratus femoris, superior gemellus. The reasoning is gluteus medius and minimus stabilizes the pelvis during the gait. Paralysis causes the Trendelenburg gait, which can be asked to you in the viva. there's a student will be standing with a Trendelenburg grade position, and the muscles will be asked to you, and the nerve that is damaged in the mentioned situation. Now comes to the question number 47. A man injured the lateral side of his knee and developed foot drop. Which muscle is affected? Options are extensor hallucis longus, flexor digitorum longus, peroneus brevis, peroneus longus, tibialis posterior. The answer is common peroneal nerve, that is loss of dorsiflexion. Extensor hallucis longus is one of the key dorsiflexors. Now comes to question number 48. A nurse with long-standing arthritis complained of a dull aching pain with bluish swelling on her legs. Which structure is involved? Achilles tendon, anterior compartment of leg, deep vein, popliteal cyst, or superficial vein? The answer is E, superficial vein. Standing causes varicose veins due to the incompetency of the superficial venous valves. That's why you have seen deep venous thrombosis cases as well. Question number 49. A tennis player cannot invert the sole of the foot. Which muscle is affected? Extensor digitorum brevis, extensor digitorum longus, extensor hallucis longus, peroneus tertius, and tibialis anterior. The answer is tibialis anterior. That causes inversion is produced mainly by the tibialis anterior and tibialis posterior. Question number 50. A driver has difficulty pressing the accelerator due to the weak plantar flexion. Which muscle is responsible? The options are extensor digitorum longus, extensor hallucis longus, peroneus tertius, popliteus, and tibialis posterior. The answer is tibialis posterior, as it assists in plantar flexion and inversion, important for pushing paddles. 51. A young man injured his medial thigh near the groin and cannot extend his knee. Which nerve is injured? That is common peroneal nerve, deep peroneal nerve, femoral nerve, sciatic nerve, and tibial nerve. C is the answer, that is femoral nerve that supply the quadriceps essential for the knee extension. Question number 52 is which artery, if damaged, the most commonly causes avascular necrosis of the femoral head, that is medial femoral circumflex artery, and the other options are inferior gluteal, lateral femoral circumflex artery, obturator artery, and superior gluteal artery. C is the option, that is medial femoral circumflex artery. It is the main blood supply to the femoral head by the reticular arteries. Question number 53. A surgeon is repairing a femoral hernia which lies medial to the femoral vein. Which structure is found in this canal? Deep inguinal lymph nodes is present in this canal. And the other options are femoral artery, nerve, iliac muscle, and psoas major muscle. Femoral canal contains lymphatics and Cloquet's node. Question number 54 is a woman with L4 to L5 disc prolapse complains of back pain radiating to legs with tingling. Which nerve is most affected? Genitofemoral, ilioinguinal, pudendal, sciatic nerve, subcostal nerve. Reasoning is herniation compress L5 to S1 roots which contribute to the sciatic nerve. 55 is the flexor retinaculum of the foot stretches between the medial malleolus and which bone? The options are calcaneum, cuneiform, fibula, navicular, talus. The answer is calcaneum. It extends to the sustentaculum tali of the calcaneum. Question number 56 is a woman cannot stand upright due to the thigh muscle weakness. Which quadricep muscle is mainly involved? Options are adductor longus, semitendinosus, vastus intermedialis, vastus lateralis, and vastus medialis. Okay, now there is a confusion in this question. In the key, semitendinosus has been marked, but when I have searched, the option are vastus medialis in the upper standing position plays the role. So now the choice is yours. In the question number 57, the same is the scenario. Which thigh muscle is mainly active while sitting down? Options are adductor brevis, adductor longus, adductor magnus, bicep femoris, obturator externus. Now in the key, the bicep femoris has been marked, but when I have searched from the KLM reference, adductor magnus acts in the sitting position. Now you can search it by your own. 58 question is a man with posterior knee dislocation has loss of sensation on sole of the foot. Which nerve is damaged? Deep peroneal, femoral, obturator, superficial peroneal, or tibial? Answer is tibial nerve passes through the popliteal fossa and supplies the plantar sensation. Question number 59. A boy has bowing of legs outward with the knees apart. Arch bow appearance. Which is what's the condition? Bilateral flat foot, coxa vera, genu valgum, genu verum, Talipes calcaneo valgus. The reasoning is denoverum, medial angulation of the tibia related to the high. Question number 60 is the Question number 60 is the spring ligament supports which arch of the foot? It supports the lateral arch. The options are the lateral longitudinal arch, medial longitudinal arch, talocalcaneal joint, talonavicular joint, transverse arch. Reasoning is plantar calcaneo-navicular ligament holds at head of the talus supporting the medial arch. Question number 6 is where should intramuscular injection can be given in buttock due to the to avoid sciatic nerve injury in the superolateral part to avoid the injury. Popliteal artery was ligated after the knee trauma, which artery maintains the food supply through the collaterals. Obturator artery supplies the obturator artery maintains the subcollaterals. 63 is a patient has sensory loss between the big toe and second toe, which addressed as a deficit will be present. Loss of dorsiflexion of the foot will be lost, and it is due to the deep peroneal nerve that supplies this skin area and dorsiflex muscles. Okay. Question number 64 is to avoid sciatic nerve injury. Gluteal IM injection should be given in which area? Upper lateral quadrant of the gluteal region for the safe side to avoid the injury to the sciatic nerve. Okay, this was for